Welcome to Senior Wellness, your trusted path to healthy aging. At first, Sarah just thought she was having a bad week. One minute, she was bursting with energy, planning 3 businesses, sleeping just 2 hours a night, and feeling unstoppable. But then came the crash. She couldn't get out of bed, couldn't answer texts, and worst of all, she felt like a stranger in her own mind. What if I told you this wasn't just stress, but something far more serious and far more common than we realize? In this video, we're uncovering the truth about bipolar disorder, a misunderstood condition that affects millions silently. You'll learn the 10 warning signs, the science behind the mood shifts, and the one symptom people mistake for creativity that could be a red flag. Let's begin with Sarah's story. Sarah was a 29-year-old graphic designer. Highly creative, passionate, full of energy. But every few weeks, something strange happened. She'd go on wild creative sprints, redesigning her portfolio, rearranging her apartment at 3 a.m., starting 3 side hustles without sleeping. She felt amazing, but soon after, her world crashed. The same projects that lit her up now made her nauseous. She couldn't leave her room. Friends thought she was flaky. She thought she was losing her mind. What is bipolar disorder? What Sarah was experiencing is known as bipolar disorder, a mental health condition that causes extreme mood shifts, from mania to depression. These are not ordinary mood swings. During manic phases, a person may feel euphoric, energized, impulsive, even delusional. In depressive phases, the same person can feel hopeless, exhausted, and emotionally paralyzed. 10 warning signs of bipolar disorder. Bipolar disorder is a mental health condition that causes extreme mood swings, from emotional highs mania or hypomania to deep lows depression. These changes go far beyond typical ups and downs. Here's how you can recognize the warning signs. Number 1. Periods of high energy with little need for sleep. During a manic episode, a person may feel unusually energized. They might stay up all night, feel restless, and not feel tired at all, even after skipping sleep for days. Number 2. Racing thoughts or fast speech. The person might talk very quickly, jump between ideas, and have trouble staying on one topic. It's like their brain is moving faster than normal and they can't slow down. Number 3. Risky decisions, spending, sex, or quitting jobs suddenly. Impulsive actions are common. They might spend large amounts of money, engage in risky sexual behavior, or make big life decisions, like quitting a job, without thinking through the consequences. Number 4. Inflated self-esteem or grand ideas. In mania, people may believe they are more talented, powerful, or important than they really are. This isn't just confidence, it's a distorted sense of reality, sometimes even believing they have special powers. Number 5. Irritability or agitation. Not everyone feels happy during mania. Some become easily annoyed, short-tempered, or angry over small things. This irritability can strain relationships. Number 6. Sudden crash into deep sadness or emptiness. After a high-energy phase, the mood can shift suddenly into deep depression. The person may feel emotionally numb, hopeless, or overwhelmed by sadness, often without a clear reason. Number 7. Loss of interest in things once loved. Activities they used to enjoy, like hobbies, work, or even spending time with loved ones, no longer bring joy. This lack of interest is a major sign of the depressive phase. Number 8. Thoughts of self-harm or suicide during lows. In the depths of depression, some may have dark thoughts, including self-harm or suicide. These thoughts are serious and require immediate support and medical attention. Number 9. Difficulty maintaining relationships or jobs. Because of unpredictable behavior, mood swings, and impulsive decisions, people with bipolar disorder often struggle to maintain stable relationships or keep a consistent job. Number 10. Denial. The person may not believe anything is wrong. One of the most challenging aspects is that the person may not realize they're unwell. They may reject help or deny there's a problem, especially during manic phases when they feel better than ever. The hidden danger, misdiagnosis of bipolar disorder. Bipolar disorder is often misunderstood and even more often misdiagnosed. One of the biggest concerns is that many people, especially women, are first told they have depression or anxiety, when in reality, they are experiencing bipolar disorder. Why misdiagnosis happens? Bipolar disorder includes depressive episodes, which look very similar to regular depression. So if someone goes to the doctor feeling extremely sad, tired, or hopeless, they may be diagnosed with clinical depression, especially if they don't mention or recognize their manic or hypomanic episodes like bursts of energy or risky behavior. The problem with antidepressants. If a person with bipolar disorder is given only antidepressants, it can sometimes make things worse. Instead of feeling better, they might suddenly feel too energized, agitated, or impulsive. This could be the beginning of a manic episode triggered by the medication itself. This reaction is a red flag that the real issue may be bipolar disorder, not just depression. Why it's dangerous? Delaying the correct diagnosis means the person doesn't get the right treatment, such as mood stabilizers or targeted therapy. This delay increases the risk of severe mood swings, relationship or job problems, substance use, even self-harm or suicide. If you or someone you know has been diagnosed with depression but antidepressants don't seem to help, they feel too energetic or impulsive after starting medication, their moods swing dramatically between highs and lows, it's crucial to reevaluate the diagnosis with a mental health professional. Bipolar disorder is treatable, but only if it's properly identified. How to get help. Treatment options for bipolar disorder. The good news. Bipolar disorder is not a life sentence, it's a manageable condition. With the right care, support, and tools, people living with bipolar disorder can lead stable, productive, and fulfilling lives. But everything begins with recognizing the signs and taking that brave first step to ask for help. Step 1. Get a proper diagnosis. The most important step is speaking to a qualified mental health professional, like a psychiatrist or clinical psychologist, who can properly evaluate your symptoms and rule out misdiagnosis like depression or anxiety alone. Step 2. Start the right medication. For many, mood stabilizers are the foundation of treatment. These medications help balance the highs and lows of bipolar disorder and reduce the intensity of future episodes. Common treatments may include mood stabilizers, for example, lithium, antipsychotics for manic episodes, antidepressants only in combination with mood stabilizers to avoid triggering mania. Important: never self-medicate. The wrong drugs can worsen symptoms. Step 3. Therapy and counseling. Medication is important, but therapy adds the human touch. With the help of a therapist, individuals learn to recognize early warning signs, develop coping skills, manage stress and relationships, understand their emotional patterns. Therapies like cognitive behavioral therapy (CBT) and psychoeducation are especially effective. Step 4. Build a routine and support system. Routine is powerful. Regular sleep, healthy meals, exercise, and a consistent daily rhythm can dramatically reduce mood swings. Also, surrounding yourself with supportive friends, family, or peer groups makes the journey easier. You're not alone. Sarah finally saw a psychiatrist. She was diagnosed with bipolar 2. Today, she still has ups and downs, but she's stable, creative, and most importantly, no longer afraid of her own mind. Share this video. Someone in your life may need it more than you know.